Hello, my name is Troy Yocum. I'm going to be performing a web history and physical examination for nursing 5461 acute and critical illness. Patient's chief complaint coming in was abdominal pain after fall. Mr. CG is a 65-year-old Caucasian male who arrived to the emergency room on June 11th, 2019 due to severe abdominal pain and inability for his caregiver to get him off the floor after falling onto the toilet from his wheelchair. EMS was called because his mother and sister, who are his caregivers, were unable to get him off the floor. Past medical history: he's wheelchair bound, he has spinal stenosis, his right foot drop, hepatitis C, which has been resolved by medication, hypercholesterolemia, and hypertension. Past surgical history of spinal surgeries as a child. At-home medication: he takes lisinopril 40 milligrams daily, Crestor 20 milligrams daily, and hydrochlorothiazide 12.5 milligrams twice a day. He has no medical allergies but is allergic to bee stings, which result in anaphylaxis. He has a family history with his father having hypertension and his mother having diabetes. He has a social history. He lives in El Paso, Texas with his mother and sister, who are his permanent caregivers. He has no history of alcohol, tobacco, or illicit drug use. Review of symptoms: patient's lying in bed, rolling side to side. Constitution is unable to sleep or rest, he states. He says his skin has been dry. He states he has no vision problems, no hearing problems. Nasal passage is obstructed with mucus. He stated oral cavity's been dry with no pain, redness, or soreness to his throat. Cardiac-wise, he has no chest pain or palpitations or edema. Respiratory-wise, he complains of no dyspnea, cough, or secretions. However, states he has weakness and uses a wheelchair. He's able to stand on his own with minimal assistance, and that he has a right foot drop. Gastrointestinal-wise, he states he has no nausea or vomiting, but does complain of upper right abdominal pain due to the fall. He voids on his own with no difficulty, denies any depression or any altered moods. On physical examination, vital signs: his heart rate was 101, blood pressure was 164/59, respiratory rate was 21 with a oxygen saturation of 90% on room air. Temp was 36.8 degrees Celsius. Generalized, he's lying in bed, restless, with his eyes closed. HENT, his pupils wrinkle round reactive, no vision loss or deficits, nares were patent, no deformities or perforation. His oral cavity was pink, moist, and intact. No complications with dentition. No swelling, redness of the throat or face. Cardiac-wise, he did have a rapid heart rate with no murmur, rub, or gallop, no jugular venous distension or cardiac carotid bruit. His nail beds were pink, and capillary refill was less than 2 seconds. Peripheral pulses were +2 with no edema. Respiratory-wise, his lung sounds were clear. He had even rise and fall of the chest with no use of accessory muscles. Tegmentary-wise, his skin was pink, dry, and intact. No bruising. Abdominal sounds were normal. Abdomen was soft, flat, non-tender to the upper left, lower left, and lower right. Only tenderness at the upper right quadrant. No visual bruising. Musculoskeletal wise, his upper extremities is a 4 out of 5 strength. His lower extremities are 2 out of 5 strength, which he stated and his family stated were his normal. He does have noticeable right foot drop with no edema, pain, or redness. He was alert but confused, although oriented ×3, and slightly irritable. Labs and diagnostics: his WBC was 18.3, His hemoglobin was 14.3, his hematocrit was 47.7, platelets were 174, sodium was 118, chloride was 88, CO was 23, BUN was 16, creatinine was 1, potassium was 3, glucose was 117, AST was 87, ALT was 100, alk phos was 134, and total bilirubin was 1.7. Chest x-ray was normal, no abnormalities. Abdominal ultrasound was performed, noted that he had a portal vein thrombus, and then a CT of head was performed also for confusion and no hemorrhage, and for fall, and no hemorrhage was noted. Assessment plan for this individual. Number 1, he had a portal vein thrombus possibly related to mechanical fall. So we're going to monitor his liver enzymes and ammonia level. We consulted hematology as well and started him on Lovenox 40 milligrams sub-Q BID. Number 2 is he has hyponatremia related to diuresis. We're going to hold diuretics for now. We started him on normal saline at 100 cc's continuous and performed a BMP Q6 to monitor his sodium. Additionally, he was hypokalemic. We replaced him with 40 MEQs PO. And we're going to monitor daily CMP. Also, number 3 had abdominal pain related to mechanical fall. Ordered morphine 2 to 4 milligrams IV push Q2 for pain. Number 4 was altered mental status, unspecified, but may be related to the hyponatremia. So we're going to monitor his hyponatremia and Q4 neuro assessments. Number 5 is leukocytosis, unspecified, maybe secondary to trauma from the fall. We're going to trend his WBC daily and obtain a urine culture. Additionally, we're going to place this individual on GEI prophylaxis, Pepsid 20 milligrams BID, place SCDs on this individual, and Lovenox for VT prophylaxis. This individual is a full code.